Welcome to this episode of Happy Birthday Wellness Quiz, Day 190, your health promotion and disease prevention podcast brought to you by Kiki Afya. My name is Sibiri Obogo. I'm a medical doctor and specialist in public health medicine. Today we're going to discuss a rather controversial topic on whether eating eggs can raise your cholesterol and by extension your risk of heart attack and stroke. So many people worry about cholesterol for a good reason. Overall, raised blood cholesterol is estimated to cause 2.6 million deaths globally, which is 4.5% of total deaths. Eggs were previously associated with heart disease risk as a result of their high cholesterol content. Now, when we talk about cholesterol, you're basically referring to a fat-like substance in your blood, too much of which can block your arteries and increase your risk of heart attack, stroke, or death. But when we talk about cholesterol in the context of heart health, we're referring to the so-called LDL cholesterol, the bad one, and HDL cholesterol, the good ones. These are substances that are responsible for transporting cholesterol from the liver to the blood or from the blood back to the liver. So risk factor for cholesterol can be either modifiable or non-modifiable. Non-modifiable, it means there's nothing we can do about it. So for example, your cholesterol starts right between 20 years up to 65 years. In terms of gender, below 50 years, men have higher cholesterol compared to women, but after 50 years, women have higher cholesterol levels compared to men. Some people have a genetic predisposition to high cholesterol levels. The modifiable risk factors include diet, physical inactivity, and overweight. So diet precisely we're talking about saturated fats and trans fats, as well as animal sources of fats such as high fat milk, meat, things like bacon, will tend to raise your cholesterol level. If you're physically inactive, your cholesterol will also go up. If you're overweight, your cholesterol will also tend to go up. Blood cholesterol comprises 85% of total cholesterol in the body, and what we get from that only accounts for about 15%. So the body has a way of regulating blood cholesterol. When you consume excess cholesterol in diet, like for example through the eggs, this triggers the liver to reduce the synthesis of the LDL or bad cholesterol. As such, most people, except the so-called hyper-responders, dietary cholesterol will not increase the level of blood cholesterol. However, there is no way to distinguish between the hyper-responders and the non-responders. So in a nutshell, what increases the risk of heart disease? Basically, foods that are high in both saturated fats and trans fats will tend to increase your level of bad cholesterol. So things like fatty meat, chicken, dairy products, sodium in bacon and sausages, as well as saturated vegetable oils used to fry. So this is what we call the egg and bacon effect, meaning that if you eat an egg alone, it doesn't increase your risk of your level of blood cholesterol and heart attack or stroke. However, if you consume eggs plus things like bacon, sausages, or if you fry the egg in saturated fats, or if you consume other sources of cholesterol like fatty meat, chicken, dairy products such as high-fat milk or cheese, then you're going to increase your bad cholesterol, because it is the saturated fats and the trans fatty acids that increase your bad cholesterol, not dietary cholesterol. So for most healthy people, eating 1 or 2 eggs a day will not have a major effect on cardiovascular disease risk. However, people who diagnosed with heart disease, hypertension, or diabetes, or the hyper-responders need to be cautious about how many eggs they can consume. The American Heart Association recommends that saturated fats should not be more than 10% of your total calories, and trans fats should be less than 1% of your total calories. This podcast was brought to you by Kiki Afya. My name is Subiri Ubogo. I'm a medical doctor and specialist in public health medicine. You can support us by commenting, liking, sharing, or subscribing to my YouTube channel. You can also support us through the M-Pesa till number 766 or the mobile number 0720 95 8250. Until next time, bye bye.